When arriving on the scene, as a first aid responder, you should consider your safety first. Next is your patient. Establish a general impression of the scene and begin your initial assessment of the patient. Do not forget to identify yourself and ask the patient if you may help him or her. First aid is the temporary help given to one injured or sick person. It is usually performed by a non-expert to a sick or injured person until a definite medical treatment can be available. In immobilizing a patient, the essential materials that you would be needing are splints, backboard and triangular bandages. Splinting is the technique to secure the part of the body that is injured to decrease further damage and to make the individual comfortable until treatment can be initiated. A splint is a device used for support or immobilization of assumed fractures. Splints may be improvised from items such as boards, poles, sticks, or whatever is available. To avoid further discomfort, you can put padding at the end of the wood with a piece of cloth or bandage. Remember your ABCs. ABC stands for airway, breathing, and circulation. Attention must first be brought to the airway to ensure it is clear. Obstruction may cause choking. This is life-threatening. In case of a tongue fallen backwards, this may block the airway. It is necessary to hyperextend the head and pull up the chin, so that the tongue lifts and clears the airway. Splinting may be applied to the fractured leg. Pull the leg gently to prevent contraction. Choose a padded splint that is perfect to the length of the fractured limb, otherwise it may cause further discomfort if it's too long or too short. Next, secure the victim's chest. Place a bandage over a wood and slide under the upper body, then gently remove the wood. Tie the bandage to the chest. Make sure the splint is attached to the body. If the victim is conscious, ask him to inhale deeply and make the knot. If the patient is unconscious, place 3 fingers before making the knot so that the patient could breathe easily. Always make sure there are no loose ends of the bandage. Follow the same procedure for the hips to secure it. Place another padded splint on the opposite side and secure properly with bandages. For added protection, put some padding in between splints and the leg, to prevent any movement. Rescuers must roll the patient to the side gently and be extra careful with the head. Check the back for possible cuts and other injuries. After checking the back of the patient, you are now ready to place the patient on a backboard. It is important that the patient is at the center of the spine board. Never lift the patient. Instead, do the push and pull technique to place the patient at the center. Secure the head of the patient to the spine board. Make sure the bandage is secured from the chin, not on the neck, to the spine board. Next, secure the upper body to the spine board using 2 bandages making an X. Do the same procedure securing the lower body. Make sure the patient is secured tightly, so that in case you need to carry the patient vertically, he won't come off. Secure the lower limbs. Ready to lift. Ready. Lift. It is important to lift the patient in a synchronized manner. The squad leader will command the group when to lift the patient. Share what you have learned with your family, household and neighbors and encourage them to be informed. This video is made for instruction by the University of Santo Tomas National Service Training Program, NSTP.